I'm sorry, Rachel, were you talking to me?
No, I was saying Danielle.
Okay, thank you. Okay,
You're on for later, though. We got you.
Thank you.
Good morning, everyone. Welcome to our July CoC convening. It's wild to believe that we are already more than halfway through July, which is more than halfway through the year. So lots to get through today. The second quarter was very busy for the CoC. There were a lot of exciting things that happened. And so we will kind of dive into that today with some of the updates from the last quarter. Rachel, were you going over the agenda or you want me to?
You can go ahead. Okay.
So today agenda, we have a lot of things to talk about today. First, we are going to talk about our TA that we received through HUD, the disaster response team. That was a large portion of the work that we did in quarter two and continues today. We'll also spend some time highlighting some COVID-19 partnerships and collaborations throughout the CoC for last year and then throughout that have trickled into this year as well. Sal's going to provide an update on our HMS privacy and policy updates and some exciting work around data integration projects. And then we are also going to have Dina from Coburn speak a little bit on Coburn and the support that they're doing for folks experiencing domestic violence and accessing housing. We have a couple of lunch and learns that will be coming out in the CoC the next month or so. And so we'll spend some time talking about the dates for that, the lunch and learn events. And then at the end, we're going to wrap up with our council conversations with Tamara Winfrey Harris and John Hall, two members from our Blueprint Council. And we've been doing that, I think this the last two meetings or so. So this will be exciting to carry that on and meet two more members of our council. Okay, so first, we wanted to spend a large portion of this time talking about all the work that we've done around Home Now in the last several months, specifically in relation to the technical assistance we received from HUD that kicked off at the beginning of May. So first, I want to talk about kind of how we got here. So we've been working with Clutch Consulting over the last 2 years, and this really opened up a network of experts and technical assistants to our community. When COVID hit, HUD reached out to communities across the country and some of the stronger CoCs to receive HUD disaster response technical assistance, primarily around the public health response at the time. So setting up non-congregate sheltering so we could decompress some of our congregate shelters, setting up quarantine and isolation sites, and also increasing encampment hygiene practices, making sure there's hand washing stations, places for people to do laundry, that kind of stuff. So throughout this work, Indianapolis was really elevated on a national level, and our engagement with that initial disaster response really opened up opportunities for us for additional technical assistance. So throughout 2020, we received a couple other opportunities for technical assistance. One was through a coordinated investment planning process. It was a workshop that really helped us put a framework around the funding that came out through the CARES Act. So this really guided us as a community to be able to prioritize the CARES Act funding to permanent housing. So some communities weren't positioned in a way to be able to put all of that funding specifically through the CARES Act ESG towards rapid rehousing. Almost all of our money went to rapid rehousing, and that was through that workshop. Around that same time, we also were able to participate in a coordinated entry intensive workshop. And this helped us adjust our prioritization in response to COVID-19. So that was a really good experience as well. So our willingness to engage with these opportunities and our commitment as a community to learn with other peer communities has really continued to open doors for us on a national level. The TA community is a really close-knit network, and now Indy is on the radar for doing really good crisis response work. And this has also allowed us to advocate in other phases for TA to pivot from the crisis response to rehousing. So our work through Clutch, we were able to articulate our needs for what we needed as far as pivoting to rehousing, and HUD actually designed TA around that. So because we've been working with TA, we were able to provide some of that feedback through Clutch, and HUD was responsive to that. So Indianapolis was actually the first community that was able to receive this technical assistance focused on the rehousing around COVID-19, which is really exciting. I think there were only 4 communities that were awarded, and we were the first to pilot it. So I think it was really clear working with HUD that our community's early life-saving action to place COVID vulnerable people into non-congregate sheltering really established this strong foundation to reactivate our rehousing strategies. And so we were reminded several times throughout this process in the TA that these were really good problems to have. And we were successful in being able to pivot our crisis response system in ways that other communities were not. So it was really exciting. It felt kind of terrible at the time to have so many people, like hundreds of people in hotels that we still had to house. But we were reminded through HUD that this is a really great problem because that meant we kept them safe, whereas other communities failed and were never able to be as successful with non-congregate sheltering as we were. From the start, we always knew that non-congregate sheltering was temporary. It was a temporary response to a public health crisis. We knew that these hotels couldn't stay open forever, and it was really time to pivot that and focus from that crisis response into rehousing and put our focus on real and permanent housing options for those that were in the non-congregate shelters. So this is our TA team. David Canavan was kind of the lead TA provider. He spent several weeks on the ground in Indianapolis, learning our system, driving system adjustments, and he engaged with numerous stakeholders during this process. So it was actually kind of impressive how many people he met in Indianapolis while he was here. Everywhere from street outreach workers and case management to Deputy Mayor Jeff Bennett and Dr. Virginia Kane, who worked really closely with the city. He worked with FEMA. I mean, he met with kind of everyone when he was here. He worked with the Crown Plaza to make adjustments that would help reduce barriers for clients entering and staying at the non-congregate shelter. That was a large part of his role, was to lead the efforts and pull everything together. Sarah Kahn was another member of the team. She spent a week in Indianapolis, but continued to work with us throughout the process. It was a 6-week intensive TA. So she worked a lot with our housing acquisition strategy and developing a process to ensure that there was greater alignment between our navigation teams and the housing acquisition team. She's also done some previous work with our community with the data integration project in the past. So it was good to see another person that was familiar with Indianapolis come back to town. Michelle Williams was another member of the team. She also spent a week with us in Indianapolis and has continued to work with us throughout that. She has a lot of experience in shelter operations, so she was able to make some adjustments with some of the flow at the shelter, at the hotel. And she was also able to provide several trainings to case management and navigation to help them grow engagement and case management skills at the non-congregate shelter. And Darlene Matthews was the last member of the team. She worked closely with leadership on the investment strategy regarding the vouchers that we currently have available to our system that we're going to learn more about later today. And both through the homeless preference vouchers and the emergency housing vouchers. It was really kind of exciting because the emergency housing vouchers, all of the information was kind of released at the time that we were receiving this TA. And it was really cool because they were kind of briefed on this first as employees from working with HUD. And then we had a meeting directly after their brief. And so we kind of had this personalized briefing around the emergency housing vouchers, which I think was a really cool opportunity. Darlene's also a national leader in CoC portfolio management work and has worked with several different communities around looking at restructuring potential strategies and adjusting portfolios to bring in more service dollars into the community. So that's something she's been working with city leadership on, examining strategies we might be able to bring more service dollars into our community by restructuring PSH grants. So let's talk about kind of where we started. So, when we first started, David kind of gave us a whole list of things that he wanted to start with. And so this is kind of the list that we started with. We had a kickoff call on a Thursday, and by Monday morning, David was on the ground, like ready to roll. He wasn't messing around and spent that first week really just learning everything about our system and making immediate adjustments where they were identified. So if there was something that we could quickly pivot on, we were doing that. He had to learn the non-congregate shelter operation. So he was on the ground. He had visited, several of our existing shelters as well. Really understanding the community vision for flow from the NCS and what we had already established in place to get people connected to housing. Looking at what kind of assessment tool we were using. for the non-congregate participants, looking at an inventory of what units do we already have available to our system, and how do we bring more units into our system through our housing acquisition strategy. Also kind of picking apart our process for selecting units and getting clients leased up. What does that look like? Where did we have gaps? Where did we have strengths that we could build on? How do we reorient that process to get people connected to units? What does the move-in operations look like? So everything from like beginning to end, kind of looking at the whole system. What kind of communication have we already done with the non-congregate participants? Some of the, when we started this TA, we were at nearly 1 year since our first non-congregate shelter opened. So some of these folks had been in non-congregate shelters for a very long time. And what kind of data did we have? I think it was the second day on site. David asked me, he said, how many people do we have in non-congregate shelters right now? And where are they at in the housing process? And it was kind of a challenge for me to answer this because data was in different places. Some of it wasn't in HMIS. Some of it is kind of just scattered. Some was focused on one specific site. And so by the end of that week, we were able to really build some really cool tools within HMIS. We were able to provide HMIS training to the Marion County Public Health Department staff that are operating the Wyndham non-congregate site. And then by the end of the next week, we had the Wheeler Family Hotel also in HMIS. So this was going to give us a better picture of everybody that was in our shelter so that we could plan and we could know where they were at in the housing process. So data was obviously going to be really important to this. And so this is a dashboard that was actually created through that work to be able to look at anyone that's in one of the 3 non-congregate hotel sites. How many people do we have there? How many people have been enrolled in court entry? How many people have been referred to housing? What's our census over time? You can see where there's this big jump. That's when Wyndham and when the Family Hotel came into HMIS. And so you can see, kind of our progress over time. And this is a dashboard that gets updated every single day. And we use it to help kind of prioritize for the day for the needs for rehousing. Another really exciting thing that came, probably the most monumental output from this HUD TA was the reactivation or the activation of our core rehousing team. And so this actually launched, David was pushing to have it done the first week and it seemed a little bit too fast, but we were able to launch it the second week. And so with the support from the mayor's office, the Blueprint Council and city leaders, the second week of the TA, we gathered frontline workers to activate a core rehousing team that would work jointly as a system in our rehousing efforts at the non-congregate shelter, specifically at the Crown Plaza to begin with. So this kind of had a couple different components to it. One is combining case management teams. So some of you may not be familiar with our ESG CV2 program. It is a huge grant, over $7 million we received through CARES Act for ESG rapid rehousing. We have several different partners that are providing case management. And so it was kind of a little bit siloed where each agency was kind of working their own caseloads. And we needed to kind of shake that up. We needed to rebuild the motor or the engine of our system. And so we brought those teams together. We had them operating on site. And Barb Williams, who is a phenomenal extraordinaire from our system. She worked at Family Promise for numerous years and actually retired from Family Promise. But we pulled her back in and she agreed to kind of coach and lead the housing navigation for this core rehousing team at the Crown Plaza. The workspace at the Crown Plaza was restructured to help us really reconfigure and operate as a rehousing headquarters. So we took over a small area of the hotel. We have big giant poster boards of a map of the city so you can see where their units are located. We have pictures of units. We have stations where navigators can work with clients to apply for units. We physically made the space a rehousing headquarters so that we could all be centered there. This was very different because before people were just kind of in and out. It wasn't one solid core. And our efforts initiated at the Crown Plaza, we're acutely aware that opportunities this moment brings to all households experiencing homelessness. So this isn't just about one specific place. It isn't about one kind of pathway or one kind of population. This is really about everyone experiencing homelessness. And this is a great opportunity that we have right now. So we knew that we needed to bring in additional staff. So we didn't just have people that were working at the non-congregate hotel at the Crown Plaza there. We also brought in frontline partners throughout the system to also receive the same orientation. And though we began our efforts at the non-congregate sites, we want to expand it from there. And we already have done that since we launched. The street outreach providers and rapid rehousing case managers were also invited to this launch of the rehousing team. One of I mentioned kind of that restructuring of the case management team. So at launch, we kind of broke it up into two teams. We had a team A and a team B. Team A is there Monday, Tuesday, Wednesday. Team B was there Wednesday, Thursday, Friday. And it really was to focus on the housing navigation piece. So we were at the beginning of the TA, we were really at the point where we needed to help people apply for units. So it was all hands on deck with applying for units, doing that program enrollment, kind of those initial first steps to getting somebody leased up. So anyone that was there, whether you were team A or team B, you didn't have your own caseload, we were all working as a system to house anyone that was there. So clients could come down and they can meet with any of the navigators to help locate and find a unit and apply for that unit. Over time, we've housed a lot of people over time. So we have several people who have full caseloads now, and so they've pivoted. And so instead of having team A and team B, everyone hands on deck with navigation, we've broken up into two different teams, one that's more focused on navigation. And when I say navigation, I really refer to the point from program enrollment until they're able to apply for a unit and find a unit. Case management really picks up after that, once a unit's selected, to help them prepare to move in and to help them once they have moved in. So we've broken up to kind of the process into two different components now, a navigation team and a case management team. We continue to grow our navigation team and have brought in several other partners to assist with this, solely with the navigation piece. So we have several members of PBSO and our coordinated outreach teams that have been trained on the housing navigation process. Horizon House and HIP have pitched in people to support navigation at the NCS. Adult and Child Path team has also partnered to have 2 staff that are at the NCS part-time to assist with housing navigation. So the navigation part of it is still all hands on deck. We're all, one united front to serve anyone that's there that still needs the navigation piece. Case management does have a specific caseload that they're working with so they can establish those relationships and continue to support those households once they're housed. So in addition to just having a core rehousing team, we really had to have a system that could support this. So it wasn't just, the team was one part of it, but there's a lot behind the scenes that have to be able to exist to support that. So we have a couple other teams that also were created as part of this restructuring to help support all of the rehousing efforts. So the core rehousing team, I've already talked about that, but their primary role is to assess households, enroll them, complete eligibility paperwork, match clients to units, support them in the move-in process, ensure housing is maintained, and identify and provide training to help support the navigation and case management team. There's also performance and data management and a coordinate entry team. That team is there to help develop rehousing metrics, develop and support data management processes in HMIS, refine assessment and referral processes, and ensure that there's a consistent flow of referrals through coordinate entry. So kind of that behind the scenes data part of that, making sure our system infrastructure is able to support all of the referrals that we're making. Housing acquisition is a huge part of this. I think we all know that it's a really tight market right now. It's really hard to find units, and we needed, we didn't have the time to do one-to-one matching. We needed to do something on a larger scale where we could bring more units into our system. So our housing acquisition team really secures units to meet the inflow and the needs of everyone that's getting referred to housing right now, and developing a process for operationalizing landlord incentives and hold fees to be able to bring new partners to the table, developing the process for managing unit inventory and case manager access to units. We're using a really cool platform called Padmission, which I think we talked about in the last CoC convening and did a little demo on. So scaling that system, bringing more units into that system, and managing system level landlord relationships. And there's also a hotel's operation team. There's been a lot of changes at the hotel in the last few months. This team is really primarily responsible for ensuring health, safety, and security of all hotel guests and the properties, and coordinating any kind of logistics, intakes, exits, contractors operating at the site. So that team manages that. And then there's a leadership team that meets weekly as well, which is focused on public facing communications about Home Now, convening and engaging agency leadership as needed, identifying and acquiring resources for Home Now teams, and identifying what the issues are, who's going to own it, and what the next steps are. I think one of the really exciting things about working with HUD through this process, specifically David, is he told us several times, if you ask for something, I'm going to say yes, and I'm going to find a way to get it. So there were numerous things where we brought up, like, you know what, at this rehousing center, we're going to need a scanner or a printer. Okay, yes, we'll go get one. You know, a big map of Indianapolis, we got one of those. Just any kind of supplies that we needed. We need more people here. Okay, yes, we're going to find a way to get them, which was a really exciting, I think, refreshing kind of aspect to be able to say yes instead of no to things. So let's talk about some successes by the numbers. So since May 17th, which was the official launch of our core rehousing team, 94 people have exited the non-congregate sites, so all 3 sites, to permanent housing. 233 referrals have been made from the non-congregate hotels to permanent housing within our system. There's a lot of referrals. 224 of those were specifically enrolled in the ESG CV2 program for rapid rehousing. We've had 129 households apply for units in PAD mission, and we've had 56 permanent housing placements specifically through our ESG CV2. So most of our housing placements have been through ESG CV2 because that is a huge, large pot of money that is available to our system. Some other successes, and I know I'm missing some stuff that were successes from this TA because it was a wild 6 weeks and it continues to be a wild time after that. But there were so many parts of our system that the HUD TA team was able to kind of impact and to help. But some other successes, and my kind of role in this has really been focused on the rehousing, core rehousing team, but some other successes. We've had some really awesome HMIS customizations. And I know most people on this call, if you're familiar with HMIS, you are not used to the word awesome being used in the same sentence. But I will say there have been some awesome customizations made to HMIS, which is really exciting. One thing that we developed is called a housing status tracker, so we can look and see exactly in the housing process somebody is at. So had they applied for a unit? Have they been approved? Did it have a move-in date scheduled? That kind of stuff. We've also been able to do make some systemic process around furniture and move-in items. It's kind of been a dog-eat-dog world where it's like every man for themselves fighting for furniture and move-in items, and every program's had to kind of manage it in their own way. We have some really great community partners. Poorhouse Welcome Home Team, for an example, that has been providing a lot of furniture and move-in items historically to the CoC. We needed to really scale this, and it's more than one partner can do. So we were able to get some funding, flexible funding, to be able to acquire furniture items, to be able to pay for movers, so that when somebody is leaving that hotel, we know that they will have a unit full of furniture and basic supplies that when they move in, which is only going to improve our housing successes. We don't want to put somebody in a unit that's empty. We want to make sure that they have a place that really feels like home. Since the TA, Wheeler Mission has also transitioned to operations, to the operations team at the Crown Plaza. So this was a big change. Coordinate entry, the prioritization addendum has been revised again to really help us align with making sure that everyone at the non-congregate sites could get connected to housing. We have 4 document specialists that were hired on a system level to be able to gather basic vital documents like IDs, birth certificates, social security cards, proof of income, that kind of stuff, which was slowing down the housing process. So this is a brand new thing that we've never had in our coordinate entries or in our system in the CoC, which is document specialists. We've been able to provide some rapid housing case manager training. We had part 1 last week and part 2 is this week, which is really exciting. We have a lot of new staff, a lot of new partners within the CoC. And so it's good to be able to kind of all get back on the same page and to provide that basic training. The family hotel has a transition plan that is well underway. The family hotel is scheduled to close August 15th, and all of those households have been connected to permanent housing and are just in the lease up process at this point. We've also been able to take this kind of on a road show. So we took our core rehousing team and we went over to the Wyndham, which is another non-congregate site, and did a day of navigation at the Wyndham and saw nearly every single person there in one day, which was really phenomenal. So I want to just take a moment to just celebrate these successes, because this is a lot of hard work, a lot of players, a lot of different agencies. A lot of resources, everything went into this. And so I think this really just takes a moment to just celebrate the success that we were able to have in such a short period of time. So use your reaction emojis or something like that to give each other kudos. Okay, I'm going to pivot now because I want to talk more about Home Now. I think in the early days, Home Now was used really synonymously with ESG CV2 rapid rehousing as a program. And it perhaps was a misjudgment on our part, hindsight's 2020, but the Home Now name was never intended to just focus on one program or one grant or one initiative. It really was envisioned even before COVID hit. And ESG CV2 became the vehicle that helped bring it to life through funding, but Home Now itself is meant to be way more expansive and go beyond just one kind of funding source. So I want to spend some time orienting you all to Home Now as an approach versus a program, because this is different. Home Now is a different approach to rehousing. It's an approach that kind of pulls together our collective strengths as a system and encompasses more of our system instead of a siloed approach to housing. And it's about orienting the work that we do across the CoC to restructure ourselves in a way that housing is central, and again, pulling together our collective strengths so that we can operate more as a system instead of individual agencies, programs, grants, etc. So Home Now has taken life through this core rehousing team, and I think this rehousing team was kind of like piloting this Home Now, this new approach. And we're ready now, I think, to scale this and to include more. We've already pulled in street outreach. We've pulled in some collaboration with ESG CV1 programs. So I want to talk about what that is. And so I want to kind of shift and use this moment as an opportunity to shift our minds a little bit to think more of Home Now. When we hear those words, it's an approach. It's not a program. So I want to talk about what that approach is. And it really has three components to it. And I've already talked about some of these already. Navigation, housing acquisition, and case management. Like these are the three components that it takes to house folks. So navigation. I also have an asterisk next to navigation and case management because this can be the same person wearing two different hats and two different roles, or it can be two very different people that have a more refined approach or like defined role. It doesn't necessarily matter, but it's important to know that these are different functions. So navigation, what do I mean when I say navigation? So this is a lot of the intake and eligibility of a program, a housing program, whether that's a rapid rehousing program, a PSH program, a voucher program, and just that basic eligibility and intake. Document collection. So we've already mentioned those document specialists. They can play a really essential role in this navigation process because some documents are needed. Most landlords want to see an ID. So that is something that's going to be important to housing. We obviously want to reduce barriers wherever possible. So if we don't need a birth certificate or social security card, we're not going to worry about gathering that at the time of housing placement. We can get that once they're housed. But let's focus on what is just essential to getting us housed. And then housing search. So I already mentioned PadMission. So that tool that we have to be able to look at inventory within our system, units that have been negotiated for our system, and then being able to use that platform to be able to apply for units. So that's kind of the navigation phase. It's really the intake into a program and then helping somebody find a unit and apply to it. Housing acquisition. So this is a really new thing. I think through Home Now and through ESG CV2, we've had the funding to be able to pay for this, which is a specific housing acquisition team. So what does that team do? They look at securing units for the system. They can use things like hold fees, incentives. HUD was really gracious in allowing incentives with our CV programs that are unique and above what is normally allowed through ESG programs. So additional incentives to bring in landlords, helping with those negotiations with landlords. Providing education and marketing to landlords, maintaining that presence with landlords and with owners, and building out PadMission so that our system can use it. And then case management, I think most of us are pretty familiar with case management, but that move-in prep. How do we get folks prepared? Do they want to tour the area? Do they know where food pantries are? Do they know where the nearest pharmacy is? So that they're prepared on the day of move-in to feel comfortable in their new home. Assisting with deposits, arrears, furniture, move-in, scheduling, collaborating with our navigation teams and with the housing acquisition team and providing those tenancy supports once they're in housing, creating a housing stability plan with the household. Those are kind of our three components for Home Now. And so I want to talk about, go to the next slide, and I'm going to kind of pivot on what that looks like functionally, like where is this impacting our system right now? So primarily, let's talk about what we have in our system. And we have a lot of ESG and CoC funded rapid rehousing and permanent supportive housing. They primarily focus on housing folks from shelter or encampments that are unsheltered. When I say shelter, that's a really broad term. It can also include things like transitional housing or safe haven. But that's kind of our traditional system is shelter and unsheltered. And then we have these non-congregate hotels that were created as a response to COVID. And then we primarily used our ESG CV rapid rehousing to target both folks that were in temporary non-congregate shelters, but also unsheltered as well, who we knew either couldn't or wouldn't or didn't want to come into the non-congregate shelters. So that's kind of where those buckets kind of our housing programs were focused on housing. CV2 or Home Now, I guess the Home Now process started in that component of using CV2. It's also helped partner and collaborate with CV1, but it's still primarily focused on where our ESG CV program started. The goal is for this little yellow circle to grow over time. So eventually we want it to really be the system. We don't want it to just be, okay, I can have, system navigation and housing acquisition focus on these specific programs. We want them to focus on all of our programs. We want to be able to open those tools up so that everyone has access to PADmission, everyone has access to housing acquisition team that can work on behalf of the entire system and not just certain funding sources. So that's kind of my challenge to you today is next time you hear the word Home Now, think of it as an approach. Don't think of it as a program. Okay, so after our TA wrapped up, there were some specific recommendations that came from that TA that I want to just highlight. There's still more work to be done. The first thing was CoC-wide workforce development support. So how do we work to maintain and increase our workforce to meet growing system and projects? These were all recommendations as things where we might want to get additional technical assistance, and we can request that through HUD. How do we partner with other systems and entities to support skill sets and needs? I think we've hired a lot of people in the last year and a half, and we're going to continue to grow and evolve and need more partners. Second is clarifying implementation and operational decision-making structures in the CoC. I think we fortunately have a really strong Blueprint Council behind us that is the leadership and the governance body for the continuum of care. But we also have really strong leadership at agency and system levels, which provide the community with assets to implement the direction from the Blueprint Council. But HUD was pretty clear in saying, it can be sometimes really convoluted on who has that decision-making power and how does that pass from the Blueprint Council to agency and system leadership to be able to implement that. So there is some clarification that I think is needed to avoid that friction so that the Blueprint Council can empower leadership within the system to be able to operate under that direction from the Blueprint Council. And there were two other areas of TA that got recommended, and we've actually requested to get started on these two things. So one is revising our coordinate entry prioritization tool. This was something that was already in the works. We have groups that are looking at it right now, but there is some HUD technical assistance specifically focused on revising the prioritization tool to make the tool more equitable to make it more equitable and to make sure that we can engage with other communities that have already revised the tool. I think there's been a lot of discussion and a lot of changes in the whole country around the VI SPIDAT, which is the assessment tool that we are currently using. And how do we build a better tool that will be more equitable and represent everyone in our system, specifically Black households. So we have requested that TA, and hopefully that will get started soon. The second is the racial equity demonstration project opportunity, which relates really well with that prioritization. And so CoC, the Indianapolis CoC will request participation in HUD's cohort 2 when the process launches later this year. So it hasn't launched yet, but we are planning on requesting to join the cohort when the next cohort starts. So through that cohort, participants will receive additional coaching and technical assistance and support from HUD TA and an opportunity to engage with peer communities around equity, racial equity. So those are really exciting things to come. Okay, I know I'm a couple minutes behind, but I wanted to talk about one more thing, which also ties in with the TA. Oh, go ahead, Rachel.
Yeah, before you move on, I had a question that was sent to me in the chat that I thought might be helpful for folks who maybe have been not as closely connected with some of the particular rapid rehousing work. Could you just briefly explain the difference between the ESG CV1 and then the ESG CV2?
Yes.
I just want to make sure that we had clarification on that, since I thought that
Absolutely.
was maybe it had been a while since we talked about it.
Yeah, so ESG CV1, and I have some slides too in a different presentation around this, but the CARES Act funding came out in 2 waves. So what we call CV1 and CV2. It really, there's not much difference in the funding, except it came out in 2 different waves. So the first round came, I believe it was around 4 million. No, it wasn't quite 4 million. It was 2.8 million or something like that for our community. I don't remember the exact amount, which came out in mid last year. And we had, I think, 6 different providers, community providers that stepped up and applied for that funding and received funding specifically for rapid rehousing. And so it's just a smaller pot of money. One specific thing about that funding is that we were able to get like a waiver in on time to be able to use rental assistance for up to 24 months with that program, which is phenomenal. So we could get somebody into a unit and we would have the funding to be able to provide 24 months of rental assistance. ESG CV2 was our second round, which was, again, much more money, over $7 million. And we were a little bit more structured at that time and had our coordinated investment strategy further along in the process through that TA workshop, and dedicate, again, all of that to rapid rehousing. But it all went under one grant, which was awarded to Merchants Affordable Housing. And then through that, they were able to serve as the single fiscal agent to manage all of the administrative parts of a grant management. They could write all the checks. They could come from a single place for paying rent for clients, and also have that housing acquisition team. And then they subcontracted with 4 or 5 different agencies underneath them to provide that case management tenancy support services. So a little bit different, because instead of one agency doing everything from case management to housing acquisition to navigation, it was Merchants focusing more on the fiscal aspect of it and the housing acquisition part of it. And then that allows our partners who are really good at the case management and navigation be able to focus just on that without having to focus on the grant management piece of it. That funding could only go for 12 months of rental assistance, was the maximum amount. So a little bit different, but with the timing, I mean, it plays out. We're hoping to have everyone housed by the end of September. So that would allow the last year of rental assistance. We could give them the full year of rental assistance. I'm happy also to answer any other questions that should come at the end of this too, if you want more details around ESG CV1 or CV2. Okay, so the last thing too, I mentioned in the TA, HUD kind of released guidance around the emergency housing vouchers. And so I want to talk a little bit and start introducing where we're at with our voucher strategy and our investment planning around both the housing, emergency housing vouchers and also the homeless preference vouchers. So we actually have a significant amount of homeless preference vouchers, housing choice vouchers available to our system right now. And so leadership has been looking at how do we kind of get that across our system, and what are going to be some of the channels to help us use up all of the vouchers. We have over 700 vouchers available to our system. So work is still being done right now around the emergency housing vouchers. It actually requires an MOU between the Housing Authority and the CoC, which we're working to finalize. So I don't have specifics, but all of these strategies can be used with a mix of those vouchers. And so some of those details are being worked out. So there's kind of a couple different buckets per se that we're going to be using these vouchers for to target. One is permanent supportive housing move on. So we have some people who've been in permanent supportive housing for quite a while. They've been able to stabilize, and maybe they continue to need a long-term subsidy, but they don't have the service level of need for PSH, and they're ready to move on from that program. The city is working on meeting with, they've been working with HUD and kind of looking at a couple different approaches. One, which could potentially be like a restructuring of our existing grants to help bring in more of that service funding I'm working with Darlene on that. So that's kind of why that's in yellow, is because we still have some work to do on that bucket. Rapid rehousing, move on. We have a lot of people in rapid rehousing in our community. In our existing rapid rehousing funded through CoC and ESG, and then also through ESG CV. So these next two buckets are kind of primarily targeting that. So folks who are in rapid rehousing but still need that longer term subsidy. So those are going to be getting launched and implemented next week, or actually this week, later on this week. We have groups meeting, implementation groups, to get started on using some of those vouchers. PSH for chronic and unsheltered folks. This is red because we still need to figure out the services piece of this. There are some services available to the CoC that we have to we're still in the planning phase around getting that service package finalized and solidified so that we can pair that subsidy with services. Navigation only. So I think this would be for folks who are in our system who don't have that service need, but need help with that navigation, need help finding a unit with a voucher. So an implementation group is also forming for that, for sheltered and unsheltered folks. And then DOC, there's been some specific guidance from HUD around using the emergency housing vouchers for reentry and folks leaving incarceration. So we're still in the planning phases around that as well. So I'm also happy to take more questions with this. There's going to be a lot more information that's rolled out. This is really the first time that we're kind of starting to socialize our strategies with vouchers. But it's really exciting, and I'm happy to answer any questions if anyone has questions or wants to email me directly about any of these approaches and the status of where we're at or how to connect with one of the implementation groups.
Thanks, Danielle. I'll give just a second here while we transition. If anybody wants to ask questions, we got a second here. We'll still happy to take those. So just a moment while we transition to our next presentation.
All right, everyone. So are there any additional questions, or Rachel, I'm up,
It's not
right?
you, Sal. It's
it's not
I'll
me?
come to you next. Nope, it's not you.
All right.
You're next after them.
Sounds good.
No worries. Matt, is this a question you'd like answered, or is this just one you're thinking about? I see something in the chat.
It's one I'm thinking about. If I'm a PSH partner, what timeline should I be thinking of as I can maybe deploy some of those move on vouchers for my folks?
So it's still a little bit TBD right now. The city is taking the lead with that. So if you have interest as a PSH provider, I would connect with Natalie from the city.
All right. Any other questions? This is always the hard part when you start screen sharing. Those of you who know Zoom, you can suddenly not see anything. So hopefully my colleagues will alert me if we get a question here as we're transitioning. Just really quick, want to thank everybody for all the hard work that's been going on related to the non-congregate sheltering sites and street outreach, connecting people to housing. I have had the opportunity to go out a couple of times to see the folks at the hotel, and it's just it's like a hive of busy bees. Everyone's just always so busy, and it's just really impressive, the collaboration that we're seeing. And as a part of what we're hoping to do throughout the rest of 2021, my name's Rachel Sample, and I work on the CoC communication side of things. And one of the things that we're hoping to do this year is to highlight innovation and collaboration that people did during COVID-19. You know, everybody was so busy last year, and it was so crazy, and it still is in many ways just as crazy. But we don't often take a chance to celebrate and recognize the amazing work that's happening every day, and especially during the challenging times we were facing last year. And so please, if you at your agency have something you were really proud of last year, or you did something really cool and you want other people to know about it, please send me an email. I dropped my email in the chat earlier. I'll drop it again in a moment, because we're going to be trying to feature more of these collaborations in our communication out to other partners and just celebrate, recognize, and give everybody a pat on the back for the work that you do every day, and especially the work that happened in the last year when things were so challenging. So I'm going to hand it over to our friends at HVAF of Indiana to share how collaboration happened last year to help keep veterans housed and to rehouse veterans during COVID-19. So Lauren and Adam, you're up.
Thanks, Rachel. Hi, everyone. For those of you who don't know me, my name is Lauren Martis. I'm one of the rapid rehousing coordinators here at HVAF of Indiana. Previously, I was the case manager under our Indianapolis Housing Trust Fund grant that was specifically created to assist veterans with HUD-VASH vouchers and work through that process. So I kind of have a unique perspective when it comes to community collaboration, not only because that was a grant that was through the city of Indianapolis and meant that I was meant to serve the community, not just HVAF, but also because I've been able to work closely with every community provider in serving our veterans, as well as you can see on the screen there, the VA HUD-VASH team, and very closely with the Indianapolis Housing Agency as well. So I do have a little bit of perspective on both, but obviously with COVID, everything we knew was thrown out the window. And it's rather appropriate, you know, when we're talking about collaboration being the main outcome of positivity coming from COVID, because that truly is the case. Obviously, in the business that we're all in, we know that collaboration is really what gets us through. And I think very similar to a lot of other organizations represented here, our biggest accomplishment, one of our biggest accomplishments at HVAF was not only remaining open and in person for services, but still providing those direct client services that we had to. You know, we couldn't close down and shut our doors. We had to remain open, as a lot of you know, and still provide that boots on the ground work that we need to do for those that we serve. This came in a lot of different methods, obviously, but as housing first providers, we're always, you know, looking to work smarter, not harder. We're looking to find creative solutions for our problems and not reinvent the wheel. But I think what COVID did for a lot of us was cause us to actually reinvent the wheel. Not that we like to do that, but we actually had to create completely new programming to do what we needed to do to help the clients we serve. So one of the great things that we were able to do in the veteran realm of homeless providers was work closely with the other community providers who serve our veterans, as well as the HUD-VASH team, the housing agency, and CHIP, to kind of create an entirely new program focused on those people that had vouchers, whether that be a HUD-VASH voucher specifically or an HCV voucher as well. We created what we called the Flex program, which allowed us to kind of bypass certain services that were completely down, or where we had those roadblocks that we had absolutely no control over, unfortunately. And it allowed us to get our foot in the door to kind of create workarounds and make sure we had forward movement for our clients instead of just sitting static. So one of the great things that came out of that was, although certain organizations and services had to close down and weren't able to meet in person, so IHA obviously had to close its doors for safety concerns. The HUD-VASH team had to go remote because of the VA national concerns that they had due to COVID. But as an agency ourselves, as well as our other community organizations that directly serve veterans, so HIP, Intacare, VOA, we all worked very closely together, along with CHIP heading us off and the HUD-VASH team, to create that Flex program and be able to sort of start to do our own internal processes to allow us to still move forward where other agencies couldn't. So one of the greatest things that came out of that was not only that community collaboration to create an entirely new program in a time that was hard enough on its own, but we were able to really get great communication started between our organizations. So we actually started a brand new weekly staffing with the HUD-VASH team, as well as leads from each of those agencies, to directly staff each and every client that's connected through that program, so that no one slipped through the cracks during that tough time. So it was really important for us to do this specifically for those clients with those vouchers, because, like we all know, that voucher is that golden ticket, right? We know that it's hard enough to get a voucher. We know that it's a great opportunity, but to lose a voucher for means beyond a client's control is just heartbreaking, right? So we wanted to do all that we can to take away what barriers we had available to take care of, and really work through that at an agency level with each of our community partners. So we were able to make sure anyone who had co-enrollments with different agencies was on the same path. We were able to make sure that anything that needed to be done was done. So internally, we were making sure we were completing our own inspections when IHA couldn't. Our certified HQS inspectors were going out and inspecting units ourselves, even when IHA wasn't on the ground. We're doing all of those rental calculations. We're doing those utility allowances and making sure that long-term these clients are set aside and good to go. And the best thing that came out of that for us is not only successfully housing all of those clients during COVID, whereas if we hadn't created this process, they would have still been homeless for an additional year, because we would have just had to deal with those agencies being closed. So obviously that's a huge success, but I think an even bigger success that speaks to what this whole meeting has kind of talked to is that positive progress for the future and what that change looks like of what we've learned from COVID times. And for us in this sense, it was still maintaining that weekly staffing. We now see that, wow, no one slipped through the cracks. We positively moved forward all these people and we identified all those roadblocks and we solved them. Let's continue that weekly staffing. Let's continue those touch points to make sure that those needs are still met. So we still continue that staffing to this day so that we are able to, now that IHA is open, now that everyone's more working on a normal level, it's a little bit back to normal. It's a little bit easier, but that still doesn't mean that we couldn't have more positive communication, more positive collaboration. So we didn't just drop that ball and say, okay, we dealt with COVID, now we're good to go. We've continued to maintain that collaboration. We've continued that staffing. We've continued that positive communication. And although, all of those challenges were really difficult, it's definitely been positive coming out of that because we've learned new ways to adapt that we didn't have before. And we now are more focused on that collaboration because we know what it can do for us. We saw firsthand what that collaboration and that positive communication, what that output was. So that's been really huge for us. And I think that a lot of other organizations in the community have seen that. Obviously, with the populations we serve, we know teamwork makes the dream work, but we still sometimes live in our own bubbles. And I think specifically for us in the veteran realm, it's really opened our eyes to the importance of that communication and collaboration, and how we can actually see positive changes instead of just putting your head down and doing what you do on your own. So I think that's been really positive for us on that level, especially with the vouchers. And I know that Adam, I'll pass it over to Adam. He is our rapid rehousing director, and he's seen a lot of positive changes as well on the collaboration side and what we've been able to do as an agency ourselves on the rapid rehousing side beyond just the vouchers.
Yeah. Thank you, Lauren, very much. I don't know what else to really add because you put it all together so nicely. But she's 100% correct. Going down and losing access to some of our community partners through no fault of anybody's, right? Because of a global pandemic forced us to, really reevaluate how we work together and focus on concentrated energy, right? Putting our efforts into the things that we could control and we could change. I want to thank the SSVF providers in the community for being willing to collaborate and sit down and sometimes have tough conversations. It wasn't always easy. Nobody's going to sit here and pretend that for the last year and a half it's been puppy dogs and kitty cats and rainbows. It's not. It's been tough. But we're pulling through. We're starting to gain some more access to housing inventory and just working together as a group and as a community, is having positive impact and positive change. There was great direction and collaboration from our partners over at HIP. Kay Wiles and her team did a great job kind of jumping in with us and leading the charge. We were able to continue to do inspections. We were able to continue to put folks into units And what we found were at the time a lot of landlords, willing to accept because nobody else was really doing those things. So for us to come in and essentially use SSVF dollars to act as the subsidy, right? SSVF was not overwhelmed, but we were given a lot of money through CARES 1, 2, and 3. So we were able to, where when a client couldn't get a voucher because the housing authority was closed, VASH would accept them into the program. SSVF would pretty much foot the bill when it came to paying rent. And the client paid whatever their portion would have been had they had a voucher. So no more than 20% of their income, and working it like that. This way, the client continues to get practice on what their expectations are and what the client needs to do to stay housed while we're in there supporting them and filling that gap until the voucher could be given to them, until it could be kicked on. So like Lauren said, working closely with the housing authority to ensure that units that we're putting these clients into met housing quality standards, met rent reasonableness standards, we're willing to accept a voucher, making sure that, HAP contracts and everything like that could kind of get signed and worked out with IHA while they were closed to the public, but, doing things digitally, doing things, IHA willing to accept documents that may be scanned as opposed to having them have to be handed in. So there were a lot of different community partners that really reevaluated why we were doing things and how we could improve upon those practices or processes and procedures to make improvements. I look forward to watching this grow and just seeing the positive results that will come out of it. That's all I've got. Thank you all very much.
Thank you guys so much for sharing that. I knew at a very high level kind of what had happened, but hearing those details, it just really demonstrates the tremendous amount of collaboration and communication you all had to do to get that done. Not an easy thing to braid funding like that and have certain funds step in and then case management step in from somewhere else. And that's just so cool that you all were able to do that. I can't wait to hear more about how it does, maybe continue in the future. That's really awesome. I'm going to go ahead and pass it over here to Sal, and he's going to talk a little bit about HMIS and our privacy policy updates. Ooh.
Thanks a lot, Rachel. Let me share my screen. All right. So everyone, thank you so much. Quickly discuss the privacy policy and client data rights, something that we want to take a look at in depth. Rachel?
Yeah, sorry. Yeah, I just got a notification. Okay. Zoom quit unexpectedly, but now we're back. So hopefully everyone got back in. That was very strange. So apologize for that little glitch.
Okay, I did come in hot, so I could see why Zoom wanted to quit. We are looking to move forward with some of our strategic priorities in regards to data integration with larger systems and different sectors, particularly the correctional system and the healthcare system. And we also have plans for foster care, et cetera, later down the line. But for the most part, what I want to do today is provide a quick overview in terms of what our the current state of our privacy policies and our partnerships agreements are, and what are we doing with that data right now as the policies currently stand. Then I'll talk a little bit more about how this ties in with strategic priority number 4, where our goal as the CoC lead and HMIS lead is to unify intersecting systems so that we can prevent folks from being released into homelessness and also help improve case coordination and care coordination. And then we'll jump into talking about how we want to modernize those policies and finally go through some of the next steps that are required. So if you've ever taken a look at your privacy policy or partnership agreements, I think most of you might have already signed those partnership agreements years ago. I think what people are most likely familiar with at this point are going to be the end user agreements that we have every user sign when they come into the system, when they start training and receive an HMIS user license. So what forms are we discussing and what are the intents of them? So we have the partner agency agreement, the privacy notice, the posting of the privacy notice, which is really intended to simplify some of the legalese that are in the documents for clients. And then of course, the end user agreement, the individual user agreement that all users have to sign before they get access to HMIS. And so these agreements really lay out the types of data that are allowed to be shared in specific scenarios. So it's making sure that we're not ever going to sell data, that we never will openly list data on the black market, list data on our public Facebook feeds, whatever it may be. It's just ensuring that we are maintaining some sort of privacy standards at our locations and making sure that we don't share data for miscellaneous tasks or potentially cause issues by leaking our clients' data, breaching our clients' privacy. These agreements also lay out the types of rights that our clients have. So what can they do to review their data? What can they do to not share their information? So these forms also go over that and lay out very critically that what is a client able to do in regards to the information that we're inputting on them into HMIS. And of course, we also these forms also lay out that we have to ensure all parties have secure practices in the use and creation of data. So making sure that there's no shared accounts, that the passwords that we're using are not a common password, making sure that the integrity of our clients' privacy is held up. And you can find links to these forms in the links that I have below. So CHIP and the agencies that we partner with have a responsibility to ensure that data is not breached from HMIS. And so anytime that there's a data breach, meaning that if you accidentally sent an email out to the wrong person, when you meant to send it to a colleague, it went to someone at Yahoo or gmail.com, that would be an instance where that's a breach, that's sharing client information. If you were indeed sharing any kind of client name or client SSNs, that went out to this party that's not a part of the HMIS collaborative or that does not have a data sharing agreement with your organization. And the same goes for us. And then again, these policies help to shape what uses we can share information. So a lot of the client data, when we talk about identifiable client information, that means names, SSN, date of birth, and those can only be shared under very specific circumstances with very specific entities. So for case conferencing, we use names very often, but that's because all those individuals in case conferencing are already in the HMIS system. They've signed their end user agreements, they've signed their partner agency agreements. So because of that, and because we are working towards housing the clients and doing administrative functions, we can share this information. And again, we also have a responsibility as a whole between CHIP and just our CoC in general to explain the rights of, explain the privacy rights that our clients have and what they are able to do in regards to any concerns they have of their information being in the system. And so I want to remind everyone a little bit about what some of the privacy rights folks have, that clients have. So a client is allowed to get access to their HMIS data. They can request a printout of their HMIS enrollments. That's their right to be able to do so. And again, another right that the client has is if even though you have to enter their information into HMIS for administrative functions, for case conferencing, to be able to, for financial reasons, a client still has the ability to request that their information get locked down to just the organization. So that's always an option for those clients that refuse to share their information or maybe concerned with having their information in HMIS. While you will have to enter the information into HMIS, there are ways to restrict it so that the impact of it and the visibility of that client's record is not widespread. And so some of y'all that are already in HMIS, you may have already seen these buttons that say restrict to org, restrict to MOU. These are clients that would be restrict to org that would only appear for your organization. And once more, clients cannot be denied services if they refuse to consent to have their data shared. So I want to talk a little bit about what happens with the data and what the privacy notice and privacy policy lay out in terms of what we can do with client information that's in HMIS. So we are allowed to provide or coordinate services to clients. So this means case conferencing, sending referrals to permanent housing providers, and then those permanent housing providers trying to reach out to system navigators. All those are services and coordination that requires client names and requires a client's personally identifiable information. Then another reason that we can disclose data is for functions of payment or reimbursement. So getting reimbursed from your funder, and operating basic administrative functions for audits, personnel, oversight, etc. And we also disclose data to law when law does a request for that information and comes to us with the appropriate paperwork to show that they are, why they need the client's information. And again, it's not just a simple request. They have to come with paperwork and a proper and a proper request in order for us to provide law enforcement any information. And then also to avert any serious threat to health and safety of the client or anyone else that the client may have indicated as a potential target. And then, of course, we also have it for academic research purposes. And for the most part, the academic research purposes are largely going to be aggregate data that gets shared. Although, there are instances where we work with contractors, and that's where client level data and personally identifiable data is shared if we are contracting with them. An example of that would be the PIT, where we partner with Indiana University in order to perform some of the PIT functionality and analysis. And we need to do that for the purposes of deduplicating client information. And then, of course, government reporting obligations. Effectively, we have to be able to report client data to HUD for the purposes of the LSA, for the system performance metrics, etc. So this all feeds into these are the current processes and the current policies that we have in place, and those policies are helping to feed into our next strategic priority, which is moving our system into a point where we want to be integrated with other sectors, with other systems in our community. So this is directly from the strategic priority 2018 to 2023 document, and I have a link right down there. But as you can see, what we want to try to do and what we want to solve for is providing client choice so that clients are able to choose what level of information, what systems they engage with. But also we have to build a system that allows for integration so that we can see the through line of clients as they move from the healthcare system to the correctional, to homelessness, back to correctional, back to healthcare, et cetera, so that we can get a better understanding of the full scope and life cycle of a client in the system that experience housing crises. And again, this is strategic priority 4. As you can see, we have a 5-year goal. And right now we are in the process of developing data sharing agreements and starting the process of trying to technically integrate and test out a couple of features and test out what matching processes will work between these two systems. And so just to highlight it a little bit more, our system is now just moving forward with establishing a lot of this technical groundwork. And as a part of that technical groundwork, we also have to start thinking about how clients in the future will be, what rights and how will we have to discuss the system integration with clients going forward through our policies and through our privacy notices that we have at our agencies. And so right now, as you can see from this, we are still in the point where we have not performed any kind of key analysis. We are still in the process of developing, we have not yet shared data. So we're in the process of developing that key analysis, and we'll hopefully be able to show you something in the next coming months. So what is the real world impact of some of these system analysis? So for some of you, you may have already started a data sharing agreement. I know that some organizations are funded partially through the Department of Corrections, and you may have needed to sign a DSA so that you know the outcomes of the clients that may be coming from the correctional system, or that might be, and helping them to decrease their recidivism rate. So some of you are already engaging in these processes, and instead of having one organization by one organization setting this up, this would allow us to be able to preempt that and allow us to be able to track those metrics and track that information that much quicker if you participate in both HMIS, but also need information from the correctional system, or to see how many enrollments a client might have had in emergency rooms. So again, this is an example of one program that is designed to help decrease the recidivism rate of clients leaving the correctional system. And so these projects aim to produce the following in general, right? We're looking to create a more comprehensive and holistic analysis of data. We've been looking at different continuums and different models that have allowed for some type of predictive analytics, some type of analytics that would allow us to better anticipate the needs of a client that enters the system. And what we found is that for the majority of COCs out there, the most successful instances where they were able to create a successful tool were in communities that had a data warehouse, that had a larger integrated data system. So that's what we want to try to replicate, and that's what we're building towards. So this also allows for better case planning. It'll allow for better case management now that you'll know if a client was recently in an emergency room, or if the outcomes of the clients going to the correctional systems, maybe you didn't know that. These are some of the things that we hope to eventually integrate that would help case management. We also have stabilized reentry planning for clients leaving the hospital and correctional systems. And again, one thing that is another potential plus is the potential for more focused cross-system funding for different initiatives that would allow us to intervene more effectively. So I started our meeting by discussing what is on our current policies. What's the current work that we're doing, and what rights our current clients currently have. But one thing that I want to mention is that the documents that we were discussing, these are when they were all last updated. You can see that our privacy policy was updated in 2015 with our client-facing privacy posting notice was last updated in 2009. Our partner agency agreement was updated in 2019, and our end user agreement was updated in 2012. It's been a long time since these policies have been updated, and we need to go through the process of updating them for the purposes of the changing technological landscape. So again, many of these concepts have remained true over time, but there are still things that are more widespread now that had not been back in the early teens. So one of those might be, and I've started to discuss this with the clients, with users that come through new user training, but things like using Google Sheets and storing client names or dates of birth when it's a free Gmail account, that is something that should violate that is sort of considered a breach, because you don't know what is on that free account. A Gmail account is not a potentially encrypted feature. That's a free account. You don't know what that company is doing with that data or what intents that company has with that data. So because of that, we need to modernize our policies and modernize our language that would explicitly discuss those issues and explicitly dictate what kind of systems users can input personally identifiable information into. And I just want to mention that using HMIS IDs without any identifying information is perfectly okay if you're using a Google Sheets or a Dropbox, something of that sort. But anytime names or dates of birth, SSNs are included, that those systems should not be used if they're free. And we also need to provide our client with an ability to determine how they opt out of system integration projects or whether they participate with system integration projects. So there currently is no way for clients to opt out of that, or there's no client choice at this point. And while our system is a partially open system, we still want to respect client choice and try to work towards giving our client the ability to determine how their data is used in our system. And we also want to be able to provide a clear process for clients to request their own HMIS data, and that's going to be a more simple fix. And another thing that we have to define is personally identifiable information. On some of the forms that was not necessarily clearly defined. So that's something that we have to also go through the process of doing. And you may figure that personally identifiable information, that's just name, SSN, date of birth. Well, if it's if we're talking about a geographic region, then we narrow it down by your race and by a general age and then by a gender. That can bring the pool down to identify 1 to 2 people, right? So that would also count as something that is potentially personally identifiable information. So what are the next steps? CHIP is now starting to engage with legal counsel to help us provide insight, as we move through the process of updating our policies. And so we'll be working alongside that counsel with a community work group that will help provide us input and feedback as we begin to update the policies and change policy or update the policies to be more cognizant of today's technology. And what we aim to do is to have a final draft for agencies or a final policy and partnership agreement for agencies to re-sign at the beginning of 2022. It's been, for some providers, it's been years since the early teens that they have last signed their partner agency agreements, and it's just good practice to re-sign that. And then we also want our working with our data integration partners to ensure that we're respecting client choice. So while we're working on this information, we also are working on a sort of opt-out feature for clients. So if a client changes their mind, we want to be able to remove that information from that system as it is from HMIS. So that's something that we're currently working with them to ensure we can accommodate technically. So are there any questions? Privacy policy, this could go on for an hour or more. This was a very quick overview of everything that is impacting our system, and we will be talking more about this as we have more information and as we start to go through the data integration process. All right, y'all. Again, thank you so much.
Thanks, Sal. Okay, we have let me go ahead and share my screen again. We would like to welcome Dina from Coburn Place on to share more about how we have been making some adjustments to ensure that survivors of domestic violence have access to housing resources. So Dina, on to you.
Yeah, thank you so much. Hi, everyone. Thank you for this opportunity. And I don't want to take just a couple minutes just to provide some updates regarding Coburn Place as we have experienced quite a bit of transition like other agencies have in the last year, but a lot of growth. So just wanted to give those updates as well, and then ensure that people are connecting as Coburn Place is a program that offers support services and housing options for survivors of domestic abuse and interpersonal abuse. And we want to make sure that those direct service providers that we are collaborating with across the county have our contact information. So if they are working with a survivor and need assistance, particularly through any assessments, any looking at housing options, even those support services, to make contact with us. We are growing. Last year alone, I think that the increase from 2020 to 2021 for community-based housing is almost 70%. Our housing team today consists of 7 housing advocates, and so many of those are on this call today, as well as our well-being team. I believe Jacqueline is also on this call, the well-being coordinator. But we are growing from at one time was a team of 5 advocates is now a team of 13. And so we just want to ensure that individuals know how to get in contact with us, and any additional information that you need about our services, our phone number is listed, as well as shoot an email to me. But knowing that Coburn is very much involved with working with survivors, their families, looking at emergency needs, short-term housing needs, as well as long-term housing needs, and then getting individuals connected with those support services. So support groups, individual advocacy, flexible funding. We have an incredible children's services program, so that if individuals want to connect with our children's services as well. So just again, thank you for this opportunity. Very small time frame. Just want to make sure that that contact information is here for the team. Thank you.
Thanks, Dina. Dina is not new to Indianapolis and our community, but how long have you been at Coburn now, Dina?
About 9 months.
Yeah.
Yeah.
Time flies. Well, thank you
Yes,
for
it
sharing
does.
this update with everyone and for providing this information. The information to get in touch with Coburn or Dina is also in the chat. So if anybody, does anyone have any questions for Dina before we hop on to our last topic before we get to our council conversation? Okay.
Thank you.
So I just wanted to take a couple of minutes to share about some upcoming Continuum of Care Lunch and Learn events that we will be sharing with the community in August. Looking forward to hosting everybody over the next couple of weeks with 2 events. And yeah, so let me just go ahead and show you what we have coming. So first, I want to invite all of our folks who are direct service providers, especially those who participate in our homeless management information system, but certainly anybody who does direct service is also welcome to participate in an upcoming lunch and learn. We have August 5th from 11 to noon. I'm going to pop a registration link in the chat for this, as well as for our other lunch and learn, but you can also visit the indycoc.org calendar to register to join. Indianapolis is launching a new series of dashboards. Earlier this year, we launched our equity dashboard, and some folks have been engaging with that dashboard and learning about our our system data related to individuals who are experiencing homelessness, who are people of color, veterans, and other special populations. And we now are launching a new dashboard called the System Performance Dashboard that allows us to not only look at system trends, but to analyze program performance from types of programs, whether it's street outreach all the way to permanent supportive housing. So please definitely take a look at this System Performance Dashboard when it goes live in the next coming weeks, and also join us on August 5th to learn more about this dashboard and how you can use the data in this dashboard to inform your program. Use it to compare your program to broader system data, things like that. And then we will be releasing our PIT count report next week. We're going to be hosting a lunch and learn for anybody who'd like to attend on August 12th, 11 to noon again. So 2 separate lunch and learns, each a week apart. Each of these sessions will be recorded and available then on our website afterwards, so that anyone who's unavailable in person can join us for some discussion online and review those on your own time. We're going to be featuring in that PIT count dashboard, or excuse me, not just the dashboard, but we're going to actually be talking about what we did for the PIT count in 2021. Some folks who aren't involved in street outreach, and other folks may not have heard kind of how we actually conducted a PIT count this year. We're also going to be hearing from some direct service providers and how our community responded to COVID-19, and give some context and some more story around this number that often gets talked about in the community. It was a very, very different PIT count for us this year, and I just want to take a moment to thank everybody who helped participate and provided data through their HMIS utilization, and also through surveying that our folks did on street outreach. There were many communities across the country who were unable to conduct a PIT count. So our community being able to do that means that we were able to learn from that process, and to better understand kind of what was happening as a part of COVID-19. So it's going to be a good talk on August 12th, and we hope you can join us. I'm going to go ahead and we're going to kick it on over now and have a council conversation. We've got 2 very special guests joining us for our council conversation today. Tamara Winfrey Harris of the Central Indiana Community Foundation, and John Hall of the Indianapolis Housing Agency. Danielle is going to help us with a little round robin rapid fire questions to learn a little bit more about our Blueprint Council members, and to give them the opportunity to share a little bit more about themselves. So I will go ahead and kick it over to you, Danielle.
Great, thank you both for joining us today. So let's real quick, if you want to just spend a minute just kind of introducing yourself and your role, and then we can kind of kick it off with our rapid fire session. So Tamara, do you want to go first?
Sure. I am Tamara Winfrey Harris. I'm the Vice President of Community Leadership and Effective Philanthropy at CICF. So that means my team does community leadership, grant making, donor services, scholarships, research, and impact, and special projects. I have been here for 5 years this June. And I'm on the Blueprint Council because what we announced our new strategic plan 2 years ago. And one of the prongs of that strategic plan under family stabilization is that we help to make homelessness rare, brief, and non-reoccurring. I am not the leader nor the expert in that work. That is Diane Schussel, who many of you know, and you know how committed she is and how smart, and we are lucky to have her. So I always have to uplift her in these circles. I am also separately an author who specializes in race and gender. So my work has appeared in the New York Times and the Atlantic and other outlets. And I recently published my second book, which is Dear Black Girl, Letters from Your Sisters, on Stepping Into Your Power, which was released from Barrett Kohler Publishers in March. I think that's it.
Great, thank you for that excellent introduction. And how about you, John? Would you like to just introduce yourself for a moment?
Yes, hello everyone. Thank you for inviting me today. I am with the Indianapolis Housing Agency. I've been here for just under 2.5 years. The work that we do at IHA is simply to provide, affordable housing and increase the supply of housing affordability throughout Marion County. We do that by administering over 10 different Section 8 programs, Section 9, which you're familiar with as public housing. One of the exciting things that's happening this year at the agency is that we are been designated a community catalyst, and we will be working with United Healthcare to actually focus on health determinants in our communities. And so that is one area where we can try to improve the quality of life for our Marion County residents. As in particular with this forum, homelessness is one of the major issues we try to address. And so our waiting list will be opening next week. We made that announcement last week. And so we are looking forward to increasing the supply of vouchers to help mitigate people who are at risk and imminent risk of homelessness. So I'll stop there. Thank you.
All right, thank you. So the first question was how you came to be involved with the CoC, but I feel like you both did a really good job of tying your work to the continuum of care. So I'm going to go to something a lot more lighthearted. What's your favorite place to eat in Indianapolis?
For me, I will say Mississippi Belle all day long. I'm so happy they're reopened.
Now I need to go check out Mississippi Belle. I'm like, do I have to choose just one place? Indianapolis is a fantastic foodie city, but I'll say I am really excited for Country Kitchen to open up again. So that's one of my favorite places as well.
Right now, I'm really hungry. Could you tell us what is one challenge that you see as important for our community to address when it comes to homelessness within the next 18 months?
I think it's figuring out how to use the resources, the money that we now have available, and adapt the system so that we can make it work for us and get as many people in permanent housing as possible.
I would echo that sentiment. We have a lot of resources coming our way, and the emergency housing voucher is one of those that have to be fully leased within 18 months. So basically, fine tuning that machine and ensuring that the people who need the resources are able to not only receive the voucher, but actually find places with landlords who are supplying affordable housing. And then I'd also expand that to say the support services that are needed to ensure that once people are placed, that they have the tools to succeed with permanent supportive housing.
What is something that you're proud of that you or your organization accomplished recently?
I would say for IHA would be the designation as a community catalyst. It's part of the Council of Large Public Housing Agencies to be recognized nationally as an area that will be focused on health determinants, and that's from the younger generations to the older, just to see how can we get our residents a better footing to be able to succeed in life and improve quality of life. So that has been one of the major focuses and emphasis with our agency recently.
So I would say this isn't directly related to our work in homelessness, but I do think it's relevant, and you guys are hearing it here first. We are working with a fund of ours to hopefully bring online by fall a scholarship that would be for families impacted by the criminal justice system, supporting everything from GEDs to 4-year scholarships and possibly 2 generations. So not just people who may have something on their record, but also their families as well. And I think if we're able to do that, it could be a game changer, and it's something that doesn't exist right now in the city. So I'm really proud of the work in that area.
Wow, both of those opportunities are really, really phenomenal. And I can definitely see the impact that it will have with the folks that we serve. There's definitely a lot of intersectionality there. Why is the issue of homelessness important to you? As broad as that is.
Well, I'll go. So institutionally, part of our statement around family stabilization is that we want families, especially those in chronically disinvested neighborhoods, to have equitable access to housing, transportation, and healthcare. And so, personally, to me, like, those are basic needs and basic rights. And in a community that has so much, I don't think anyone should be without those things. So it troubles me to see people without access to those very basic needs.
Great. And for me, I would say, urban policy, the first urban policy that you learn is about housing, and that housing stabilizes communities. And without housing and a place to call home, our communities are destabilized, and it just facilitates, negative spillover to occur. So homelessness is a major issue in stabilizing communities. And so for us at IHA, we try to attack it on a couple of levels. One, with the voucher, and two, with our communities. And more recently, last year, we launched foster care youth initiative to independence, because HUD noticed that a lot of foster care kids were immediately becoming homeless when they turn 18. And so that's another issue with homelessness that we have to attack. And so for us, it's helping to bundle our resources, but also reach across and have coalitions with each of you in this forum to make sure that we're maximizing the opportunity to reduce homelessness throughout the area.
Okay, back to the lighthearted side of it. What's your favorite vacation spot to visit and why?
I would say the Caribbean. I'm trying to do all the islands, so I'll leave it generally as the Caribbean. But I like the island of Hispaniola and Martinique.
So I actually have two answers that seem completely opposite of each other. My favorite city to visit is New Orleans. I just love the culture. I love the rich culture. I love the food way too much. I love the pralines, and I love the drinks, which is probably surprising to anyone who knows me, because I also hate the heat. So it's very difficult, but I also love going into the woods. So if I can't be in New Orleans, it'd be awesome to be like in a cabin in Brown County or somewhere.
And last question, what's something that people would be surprised to know about you?
I guess I'll
make John go first. Yeah.
Okay. I thought we had our thing going. We were toggling it, but I would say that I speak French. I'm fluent in French, and I studied and lived in France for a while. So I'll go with that.
Wow, that I should have gone first if I had known that's what you were gonna say. Okay, here's a weird thing people don't know about me. Once in my previous life, I spent a day driving around New York City in the back of a limousine with Mikey from the Old Life cereal commercials. And if you aren't old enough, you probably don't know who that is. Mikey and his brothers, who, by the way, were the actual brothers in the commercial. So there's some behind the scenes tea for you.
All right, thank you both. This was a really great time getting to know you both, and thank you for the work that you do on the Blueprint Council.
Thank you all.
Thank you.
All right, I'm just going to quickly share some contact information if anybody needs to get a hold of the Continuum of Care contact email. If anybody wants to stay on, has any questions or concerns that they want to discuss, we'll be on here for a little while and happy to visit with you if that's something that would be helpful. Just make sure that you keep an eye on your email. The next couple of days, we'll be releasing that information about our upcoming Lunch and Learn series. We'll be sending out a follow-up email for this meeting with copies of the recording and other helpful links that were shared today. So if folks want to stay on for a little bit, that's fine. Otherwise, we'll go ahead and we will see you when we see you. Thank you so much.
Thank you, everyone.
I'm going to go ahead and turn off the recording. I can find it.
Are we gonna have